Hi, my name is Dr. Christopher Van Tilburg, and I'm coming to you from the Hood River County Public Health Department in Hood River, Oregon. Today I'm going to talk about exposure and our exposure workups, how we investigate people who have tested positive. We've had 2 cases in Hood River so far, and I want to tell you a little bit about the process. So at the health department, we use a system that the state uses, and we get notification of a positive test. It's the same system we use for example, other reportable diseases like measles. And so when the notification comes in that somebody tests positive, we immediately have an influx of people to the health department, which often occurs so far has occurred on weekends. And so we task one person for doing a press release, and one person gets tasked with calling the patient who tested positive, and one person checks in with the primary care provider. And it's a lot of work, and we do it really, really quickly. Some of these, our 2 investigations have occurred really quickly. And so we're fortunate in that when we do these investigations, we rely on the Oregon Health Authority's guidelines, which is what everybody in health departments are using in the state. We have guidelines that we follow, and we follow them fairly methodically and specifically. And so when a positive person comes in, we start our investigation from the day that they become symptomatic. So that's the day we start with investigating who they may have had contacts with and who they might have exposed. According to the Oregon Health Authority, we investigate primarily household members. That's the focus. And we also investigate people whom a positive patient might have come in contact with that is at high risk. So that would be somebody, if they were visiting somebody in, for example, a long-term care facility, or if they had a close friend who is immune compromised. So those are the people we focused on. We don't focus on everybody in their community that they might have come in contact with or spoken with over a large range of time, because it's not practical and it doesn't help us address COVID. If you remember anything from this video, you should know that there's a lot of people, we don't know the number, but there's a lot of people that are asymptomatic carriers. It might be as high as 20%, but we just don't know. So people are walking around with COVID and spreading it, but they have no symptoms themselves. And so this is why it matters much less who actually tests positive, but it's really important that we all follow good hand hygiene and we all practice social distancing. So that's really, really important. Our investigation starts with a patient from the day that they become symptomatic and goes forward. So we don't go back retrospectively on the days before they were symptomatic, and that's because of the Oregon Health Authority's recommendations. We don't do widespread testing in the United States. We don't do it in Hood River. A lot of reasons behind that, but the primary ones that are public health issues are we don't have enough tests, and we don't want to expose healthcare workers to people who are either asymptomatic or have mild symptoms that don't otherwise need to see the doctor. And so it's really important, again, that we follow good hand hygiene. And if you don't get a call from the health department, that's great news. That means we've done a thorough investigation and we've contacted everybody that needs to be contacted. Okay, so thank you very much for listening. Tomorrow we're going to go on a field trip. I'm going to talk about personal protective equipment, and I'm going to address our some innovations that we have in our community for addressing the shortage of personal protective equipment. And I'm also going to talk about cloth masks, because we're getting a lot of calls about this at the health department. So I'm going to talk about cloth masks tomorrow. So thank you very much. Be safe.